Hello, everyone. I think I'm going to get started. So thank you all for coming, and I want to thank the HDSA for having me here to talk. I didn't realize I'd be talking after such a motivating speaker who really did tap into a lot of the importance of lifestyle and exercise and fitness, so I think this will tie in really nicely. I think if you can take away one thing from what I want to talk about, it's really about empowerment, and that's really what the speaker previously was really talking about is empowerment. And it can be really distressing to get a diagnosis where you feel like you have no control over what's coming next, and whether you're at risk or whether you have symptoms. Feeling like you have no control is more than frustrating. There's not really a good word for that. But I want to talk a little bit about how to give yourselves a little bit of power back with this disease, and what you can do to really have some power and some control to some extent over this disease. I'm a neurologist, and I am the director of the Huntington's Center at Northwestern. These are some necessary slides from the Huntington's Disease Society of America about sharing information. Just going to put this up for a second. And then in terms of any financial disclosures, there are none that are relevant to this talk. So when we're talking about treatment for Huntington's disease, unfortunately today, there are no neuroprotective treatments yet. That would mean treatments that could be prescribed to you that are FDA approved that slow down or stop the disease. That's not just Huntington's, unfortunately. That's true for many neurological diseases. That includes Parkinson's disease, Alzheimer's disease. And a lot is being done, and you'll see a lot of stands outside with companies that are investing in trying to find treatments that will slow or stop this disease, and so there is a lot of hope. But today, in terms of practically what we can do for people, it's really a focus on these goals that I've listed here. It's about facing the diagnosis and educating people about the diagnosis. We focus on genetic and psychosocial counseling. And then symptom therapy, how to reduce symptoms, how to reduce the burden of symptoms, whether they're physical, emotional, or cognitive, how to maximize function, and how to optimize each day's quality. And so while the ultimate goal would be to extend life, the focus that we're going to be talking about is how to optimize the life that you have. And it really does take a lot of specialists and professionals to do this. It requires a neurologist, a psychiatrist, sometimes a psychologist, a rehab team, physical therapists, occupational therapists, and speech therapists, genetics counselors, social workers. And so it really does require a center with expertise and multiple people with specific expertise. So personally, I'm going to be talking about exercise. I don't have expertise in physical therapy, and I work with a physical therapist who has that expertise, who can talk about what specific exercises people should do. So this is our center. For those of you who are local, we became a center of excellence just this year, and we really focused on Huntington's over the last couple years. This is our location, our phone number, our website, our email address, etc. We're a Huntington's study group research credentialed site as well. And we do have a symposium of our own that we do in November. So if you are local, save the date for November 11th for more education about Huntington's, if you don't get enough out of today. And so, as I said, it takes a lot of people to manage this disease. And so at the center is the person with Huntington's, and you can see all the services around it, including the neurologist, neuropsychiatrist, and many of the others that I mentioned. I didn't mention also trainees, fellows, residents, medical students, and other support services, nursing, and research team. So why exercise? Why talk about exercise? And it's an important question in this disease because this is a genetic disease. So if this is a genetic disease where you inherit the disease regardless of what you do, why exercise? Well, there's a lot of reasons that exercise makes a difference in general in everybody, and Huntington's is no exception to this. Exercise improves fatigue. It improves mood, and you heard the speaker in the previous talk talking about that. It does improve, it is the best treatment for depression and anxiety. The natural endorphins that are released are really important. It improves cardiovascular health. It improves immune function. It has anti-inflammatory effects. There's a social element to exercise, assuming the kind of exercise you're doing is with other people. And then it really is focused on promoting a level of independence. And with a disease that naturally there is some degeneration over time in that level of independence, we want to maintain the level that people have for as long as possible. So ultimately, the goal of all of this is to improve quality. HD is a disease that does impact balance, and so specific benefits of exercise to people with HD can be improving balance. So the balance response is naturally impaired in this disease. The center of gravity is a constantly moving target with the chorea. The movements really do put an extra demand on the body. And then there's this increased sensitivity, and so you may have noticed this if you have Huntington's or if you've seen people with Huntington's, that there's this sort of exaggerated response that can happen as you're approaching a target. You may see people picking up a cup and trying to set it down, and just setting down a cup can kind of have an exaggerated movement associated with it. Approaching a chair can have an exaggerated response. So there's this increased sensitivity to position changes, which can add an element of difficulty. But balance gets better when it's used more, and it's maintained better when it's used more, and when there's training focused on balance. And it's really the focus is on controlling different body parts, which can be moving in all different directions in Huntington's. And so we really want to focus on how to improve balance in the feet, in the hips, in the trunk, in all different areas. Now, exercise needs to be directed, individualized to the needs and the abilities of the person. So it needs to really be appropriate to the abilities. It should be enjoyable. Nobody is going to exercise if they don't enjoy the exercise. They'll do it once, they'll do it twice, and they'll never go back. As I said, it should focus on strength and balance. Strength is important as well because for balance, core strength, core muscles can really make a difference in terms of a person's balance. And then it needs to be safe, which often means that there needs to be some education through some kind of therapist with training who can tell you what is safe to do, what maneuvers are best to do, and to know the limitations and the equipment that are being used. Just a kind of an informal show of hands, who here exercises 3 or more days a week? It's pretty good. Okay. It's about maybe half of the people here. So I really hope that after this talk, it'll be everybody in this room that sees the importance of this. So I mentioned that the question does come up. This is a genetic disease, and so people will say, what is the relevance of, how does this affect the disease? How does it impact the disease that is a genetic problem? And so I think it's worth spending a little time on this. And with most diseases, we talk about a combination of genetic factors and environmental factors that lead a person to get the disease. And there are some diseases where the genetic part is smaller and the environmental load is higher, and some diseases like Huntington's where the genetic load is much higher, clearly, but there probably is still an environmental impact. And the reason we say that is we see people with Huntington's that have the same mutation, that have similar repeat lengths of that mutation, and yet they experience the disease really differently. Different ages of onset, different rates of progression, different symptoms may be more prominent than others. And so there have to be other variables that go beyond just the pure genetic mutation that impact the disease course. This is a graph that's looking at the length of the repeats that people have compared to the age of onset of their disease. And what this graph is showing you is that certainly we know that as the length of the repeat gets longer, the age of onset tends to be a little younger. And as the repeat is shorter, the age of onset tends to be a little later. But you see the vertical bars are showing you how variable that is. So there's a huge range of variability within each age group. So if you just look at if you just look at 45 repeats, a person who has, is my mouse working there? No, I'll use the pointer. So if you, nope. Okay, so if you look at a person with 45 repeats, you could not predict exactly the age of onset. You could say it would be around here, or maybe around 42, but look at how variable it is. There may be people that present around age 60, there may be people that present around age 30. There's a lot of variability. So it's not that predictable, and there has to be something else that explains this variability beyond just the number of repeats. And so people have said, well, it may be other genetic factors. So there's a group, it's called the GEM-HD Consortium, and there's a group looking at, could there be other genes on other parts of our DNA that make it more or less likely to have the onset of the disease earlier or later. And they actually found one recently. They found a gene on this, and this is called a Manhattan plot, where you can see it kind of stands out in this one area on chromosome 15. They found this one area that correlated with people having an earlier or a later onset of the disease. So there probably are other genes that play a factor in the age of onset. This one in particular, if someone had it, it made it, I think, 4 years earlier, or one was 4 years earlier, and another gene they found was 6 years later, on average, of getting the symptoms to start. But there are probably also environmental factors. And so beyond the other genes that may be playing, I think exercise is one example of an environmental factor that may affect both the age of onset, the progression, the rates of progression. It's probably one of these variables. So we start with animal models, which I know are not that interesting, but that's where we really start to learn about Huntington's. And there are animal models of Huntington's, mice models, rat models, where they actually cause the Huntington's mutation in the animal, and they develop the symptoms of Huntington's. And in animal models, they've been able to see that that if you stimulate an animal with more cognitive and motor stimulation, that it actually delays some symptoms of Huntington's in these animals. And the theories are that there's what we call synaptic plasticity. You may have heard the term neuroplasticity, that the brain still maintains the ability to form new connections and form new bonds from one neuron to the other. Even in a disease like Huntington's, even in a disease like Alzheimer's, we still see that while certain areas of the brain are degenerating, people still maintain the ability to form new connections and learn new things. And so that learning of new things, whether they're physical or cognitive, probably leads to these new connections in the brain that maintain or slow down disease. There's also this concept of neurogenesis. So we make chemicals, brain growth factors, and exercise is one of the things that actually helps release brain growth factors and helps us form new neurons and more neurons. And then there's an impact between the mind and the body. And what that means is, when someone is, a simple way of thinking of it is, when someone is stressed, their neurologic symptoms get worse. And the disease didn't progress. The stress occurred in the last hour. Person's chorea may get worse, but the disease didn't progress in the last hour. The stress drove the chorea to get worse. So we see this all the time. We see that the impact of mood issues, anxiety, stress, depression, other illnesses have an impact on physical symptoms. And so there's this connection between the mind and the body that's reversible for some people. So here's another example in an animal model. They had these the mice with Huntington's mice run on a treadmill regularly, and they found that it improved their. I don't know how these researchers can assess cognition in mice, but they can. This isn't unique to Huntington's, but this is done in a lot of studies. So it improves their cognition. It delays the onset of their motor symptoms. And for motor symptoms with these mice, they usually have them running on like a rotorod, and they see if the mice can stay on the rod as it's rotating. And so they have ways of assessing this. And they also measured their brain growth factors, and they saw that with treadmill exercise, they did see increase in these growth factors in their brain. And then another one was just looking at the environment. So they took mice with Huntington's and they put them in a stimulating environment, one with a lot of wheels and tunnels and climbing frames and ropes. And then they compared them to mice that were just in a very boring environment where they were just fed. They were just given access to food. And the mice in the stimulating environment did much better, and they just had overall slower decline in their general health compared to the mice that were in the more boring environment. So is there actually evidence that exercise helps in people with Huntington's? Because that's what you care about, and mice are not people. And we see this over and over again. We find things that help in animal models. When we try and study them in humans, we don't see the same effects because there's differences between animals and humans. So this was a nice study. It was a retrospective study, which means they did a survey. They looked at people who had already done something. They looked at them kind of in the past. They looked at 150 people with Huntington's in Australia and New Zealand, and they assessed how passive or active they were. They measured passivity based on different things that people would do. It could have been exercise, it could have been doing chores, it could have been arts and craft activities, it could have been a lot of different things, but how passive versus active someone was, and they scored it. And they found that passivity, the more passive someone was associated with an earlier age, by about 4.5 years, earlier age of onset if they were more passive compared to the least passive. And so this was the graph showing that. On the bottom you have how passive they are. So more passive goes to the right. And then the age of onset. And you can see again, the least passive had a later age of onset. The most passive had an earlier age of onset. And that is controlling for the repeat length. So it tells you that there is some control that suggests some control over the disease. We can't say for sure whether it's the activity that is slowing down the disease or whether there may be something about those people that present later which makes them want to be more active. That's the nature of this study, but there is a connection. We can say certainly that there's some association. More studies in humans. So this was a study looking at the first one on the top was looking at cycling and resistance exercise, so strength building exercise and aerobic exercise, twice a week for 12 weeks compared to usual care, which meant they weren't doing anything special. And they saw in this study improvements in walking, improvements in cognitive outcomes as well. And then in another study, they did home exercises with a DVD, just an instructional exercise DVD, in 25 people 3 times a week, again, compared to usual care, which meant they weren't doing any special exercise. And again, they saw improvements in this time in gait speed and in balance. And what probably shows the best benefits is what we would call multidisciplinary rehab. And so this is a combination, this isn't just exercise, but a combination of physical therapy, speech therapy, occupational therapy, breathing exercises, cognitive exercises, kind of all put together. And so in this one study, doing that for like intensive 3-week multidisciplinary program, and they did this for 3 weeks, 3 times a year. And they saw improvements in motor function and in daily life activities, ability to perform daily chores and daily activities. And then another one that I have below, which in a similar multidisciplinary clinic showed improvement in balance, in mood, in cognition, and quality of life. So we do a multidisciplinary clinic. This is formerly known, if you're local, you may have heard of the Rehab Institute of Chicago, or RIC. They changed their name and have a brand new building on our Chicago campus. Now they're called the Shirley Ryan Ability Lab. And they have a Huntington's clinic that we refer patients to that has that kind of multidisciplinary program with PT, OT, speech all together. And this is just what the inside of one of the parts of the facility look like. It's really state of the art. And so what you see in a program like that, what you should expect to see is a physiatrist who's a doctor of physical medicine and rehabilitation. Nurses, usually physical therapists, occupational therapists, speech therapists. Speech therapists focus not just on speech, but also on swallowing and also on cognition. And then exercise physiologists who can tell you kind of what exercises to do, what equipment to use, and how to use it. And a few goals of this kind of practically are, first to sort of establish a baseline. I think I have that on the next slide. So to establish a baseline, to really get a sense of someone's balance, cognition, strength, motor function, and to be able to monitor that over time and assess how things are changing over time. But then also to really identify what specific challenges a person has and how to maneuver around those specific unique challenges that each person might have, whether that requires some kind of device to help someone or whether it's simply retraining. And then just ongoing assessments with teaching home exercise strategies to kind of maintain those benefits. What I see often is people will go to a multidisciplinary rehab program, they'll get benefits, they'll go back to their usual routine though after it's over, and you start to see them lose those benefits pretty quickly. And that I see that over and over. I mean, you really have to be taught strategies and exercises that you can keep doing on your own to maintain the benefits. So examples of some practical kind of treatments from our physical therapists and physiatrists. So really they'll assess the strength and the balance and the gait, and then they'll design a tailored treatment based on it. And so an example would be if someone has balance problems, they might talk about specific exercises like certain stances that they should practice with their practicing standing with their feet together, practicing standing on different surfaces like carpeted, wooden floors, foam surfaces, challenging them with those sorts of things to try and elicit different levels of motor control. For cardiovascular fitness, if someone is just deconditioned, then they'll find safe and appropriate ways usually to improve fitness, mobility. So it can be things like marching in place, sometimes certain kind of stationary bicycles, practicing going from different positions, from lying to sitting, sitting to standing. Those sorts of exercises can be useful. And again, they need to be tailored. If strength is a problem, for instance, if someone has trouble with their posture when they're sitting or they're leaning forward, there can be ways to strengthen core muscles to improve posture, to improve balance. And then chorea, which is obviously a common symptom that we see, there are ways to work with patients on compensating for that. Sometimes weighting things, so using things that are weighted can reduce the chorea sometimes. Sometimes water therapy, swimming therapy can be useful if chorea is getting in the way of exercising in other more conventional ways. And then for gait, certainly lots of different diseases cause gait problems, and so therapists are usually very familiar with treating gait, but the gait in Huntington's is unique in specifically in the way the chorea impacts it, but also just impulsivity that can affect gait. And so using strategies to help with attention when people are walking can be really useful. So, and in different stages of the disease, people really can do different levels of exercise, and we can expect more out of someone at an early stage compared to a later stage. But there are things that should be done at each stage of the disease, and I kind of break it into early or pre-symptomatic, and then kind of middle stage and late stage. And so in the early stage, or either the pre-symptomatic or the early symptomatic stage, it's really important to be doing rigorous exercise to challenge your strength and your balance, both in an aerobic standpoint, from a strength building standpoint, and a balance training standpoint, because you can do a lot and you can push yourself in those early stages. In the middle stages of the disease, balance training becomes a focus, and balance becomes more of a problem often, but there still needs to be a focus on strength and aerobic in addition to balance. Assist devices is where it gets a little difficult because working out while you're in need of a walker or a cane or some other assist device can be challenging. I actually think there was a study out of Ohio State that actually looked at whether assist devices are a hindrance to people being physically active, and actually sometimes they are, particularly canes. I often see people come to my office with canes and they're sort of carrying the cane around rather than actually using the cane. And that just becomes an extra barrier because then you have something that you're holding that's keeping you unsteady. And so they actually found in this study that a four-wheel walker was fine, but anything other than that, people actually had a decline in their gait as a result of using it. So it is important to think about and talk with a professional about what equipment you're using. And oftentimes in the middle stage, if you are exercising, there needs to be some supervision, sometimes someone holding on or walking with the person who's trying to exercise. In late stage, if someone has limited mobility, especially if they're spending most of their time in a bed or in a chair, it still is important to not neglect physical activity. Stretching is really important to prevent muscle contractures. If people aren't moving enough, the tendons can actually get shorter and the limbs become stiffer. So it's important to do regular stretching. It's important to prevent bed sores by making sure there's regular movement. And then breathing exercises to keep to lead to less likelihood of pneumonias, just to help strengthen the cough response and can be very important as well. So I'm going to split this up into the next two slides into the independent ambulators and the people who need assistance to ambulate. But with the independent ambulators, clearly there's a greater ability to do more with exercise. And it's really critical to maintain that for as long as possible. So you need to keep moving to maintain that independent ambulation. And so daily exercise, if possible. That can mean riding an exercise bike, strengthening exercises, but I'll talk about some alternative forms of exercise as well, because it does need to be engaging. Walking frequently, not being sedentary. My patients who are more active just seem to do better. My patients who are sedentary, they just don't do as well. I mean, that's true for not just Huntington's, that's true for a lot of diseases that I take care of. And then engaging in meaningful activities is important too, because you want to stimulate the mind in addition to the body. And so that can mean volunteering, that can mean visiting with other people and being engaged in conversations beyond sitting just in front of a television. Hobbies and crafts can also be good because they do stimulate the mind in addition to being something physical that you can do. And then for people who need supervision to ambulate, again, thinking about how to do that safely, having someone with them to prevent falls, and then doing it in a safe environment where you can reduce the risk of injury. As you can see here in terms of like daily exercise, again, still recommended that it be daily. Strengthening exercises can be done even in a chair. Range of motion exercises can often be done in a chair, and I'll give you some examples. Just having regular routines of walking for meals, for bathrooms, for having prearranged times to walk even, so that you can be sure that your loved one isn't walking alone and having a risk of falling. Having plans for when you're going to walk and for what activities you're going to walk. And again, engaging in meaningful activities. So just some examples of some exercises a person in a middle stage of Huntington's can do. And this is from one of the therapists. Her name is Melissa Leher, who helped provide this information. So she would recommend, for instance, 10 reps of each of these things. So you could sit with your legs out in front, like sitting on a floor on a mat with your legs out in front, and do some hamstring stretches where you reach out and touch your toes 10 times in a row, and then shoulder stretches with one of the, take a big ball and lift that over your head 10 times. You can move the ball left and right 10 times in each direction. So again, you're getting some strength building. Depending on how fast you're doing it, you may be getting some aerobic activity out of that and some stretching out of that. Jumping jacks just with your arms, so without having to jump up and down, you can do jumping jacks like this, and that's still good for your upper body. And then switching positions, and so she has kind of these sets of like 10 reps for different positions. So then you get on your back, and you do leg lifts, you do chest presses with a ball, you do bicycle kicks, and so there's definitely something that someone with limited mobility is able to do, lying down on the floor, for instance. There are, for any of you who may be physical therapists out there, if you're not that familiar with guidelines for Huntington specifically, there actually are, I assume the HDSA has these. This is from the European Huntington's Network, which actually has guidelines for physical therapists on specific strategies. But I also want to mention some alternatives because, and you heard about some really interesting alternatives from our keynote speaker. I'm not recommending you all go out log rolling. I wouldn't go log rolling personally. I'd be a little, I think I'd fall immediately. But find things that you enjoy and that still keep you active. And just some examples of adaptive sports that people can do often, even with physical disabilities. Sometimes these special kind of bicycles, you can see this kind of recumbent bicycling, hand cycling, golf, bocce ball, things like that. I found some other more interesting things. So the Nintendo Wii has actually been studied, been small studies, nothing really too impressive, but in some small studies, they actually had people with Huntington's using the Wii as a form of getting exercise. There's the Wii Fit and some other kinds of ways to do this. And they found improved mood, improved quality of life, and they even saw some improved motor function with people doing this. And then there's actually a study out of, I think this was out of Ohio, where they did a Dance Dance Revolution video game as a way of improving exercise in people with Huntington's. And they did 45 minutes of this twice a week for 6 weeks. And they actually saw improvements in some measures of gait and balance in people who did this. How long those are sustained or maintained, I don't know. It was a short study, but I think it's an interesting and inventive way of getting exercise that's actually enjoyable. I think virtual reality is interesting. This is being studied a little bit more. Ways of you can harness people in So there's less concern about falls, and you can practice things like avoiding obstacles. So you have people harnessed in, and they're watching like a virtual world, and they're trying to navigate that virtual world, and maybe something rolls at them, and they have to learn to step over it. And so it's a safe way to kind of practice those abilities, agility, and different things. And then other recreational activities that are worth looking at. Dance is one that's been shown a lot in Parkinson's disease, and I think is worth looking at a little bit more in Huntington's as well. Tango dance in particular, or any kind of dance where someone's holding on to the other person, can be useful because, again, there's less of a concern for falling. But dance has a lot of possible benefits for balance, strength, footwork. It's an aerobic exercise, and it's a social activity. So it has a lot of reason to consider. Gardening, a lot of people enjoy, and then arts and craft activities, again, to keep your mind stimulated while you're physically active. I mentioned this kind of mind stimulating, the importance of that, and it really does, if you look at just the general population, we know it makes a difference. And it hasn't specifically been looked at in Huntington's, but in this study of 2,000 people, they looked at what made it more or less likely in the general population for people to become cognitively impaired. And of course, Huntington's causes cognitive impairment, but in general, we see that regardless of whether people have Huntington's or not, that there's less of a risk of getting cognitive impairment if you have, and it actually shows these different activities, if you're engaged in these different activities. And so, for instance, computer activities were associated with a 30% risk reduction of developing cognitive impairment later in life in the general population. Craft activities also with about 30% risk reduction. Social activities are up here. Playing games like chess or cards was associated with a risk reduction. Reading was associated with a risk reduction. And again, cause and effect is always a question in these sorts of studies. You can't say based on this that these activities prevent cognitive decline, but there's a connection. People who do these activities more have less cognitive decline. And so I think it's important to pay attention to that. To wrap up, just a few other kind of lifestyle and health tips that are worth paying attention to beyond exercise. And so I just categorized three things: nutrition, sleep, and just general stress management. Because these are things that everybody should be paying attention to, but in any disease, these are going to affect the course of the disease. They're going to affect your daily function. I'm sure that anybody in this room who has Huntington's would notice that if they get a bad night's sleep the night before, their symptoms seem worse. Cognitively, they don't seem as sharp. And so things like that can really, again, have an impact, whether it's a mind-body impact, but it's something that's important to pay attention to. So in terms of natural products, this comes up all the time. People always want to know, is there something natural I can take to help slow down the disease? And unfortunately, the short answer is we don't know. From the things that have been studied, we haven't seen any clear signal of benefit yet. So some natural products that people were interested in studying were antioxidants. Antioxidants are compounds that when we take them in, they bind to free radicals in our body, which can be harmful to our brains and our body. Free radicals are these molecules that float around in our bodies that are sort of unstable, and they cause damage to our brains. And the hope was if we take a lot of antioxidants, and you block these free radicals from causing damage to the brain, maybe you'll slow down the disease. So far, we haven't found one that does that, except in animal models where it does. But in humans, we haven't found that. So coenzyme Q10 was studied, and unfortunately, that study was stopped for futility because they just didn't see the benefits compared to a placebo or a kind of a sugar pill. Vitamin E is another one that was not shown to have any benefit over placebo, and then creatine was another one that was stopped early for futility because they didn't see benefits. So there weren't harms to taking these, but they just didn't see benefits. A few others are being studied. So green tea extract is one that's being studied. The Mediterranean diet is one that often people will look at. Mediterranean diet is just a diet that's high in antioxidants. So if you think about the Mediterranean foods, these are things like olive oils, which have omega-3 fatty acids, fish that have like large fish that have like salmon that have omega-3 fatty acids, colorful vegetables, fruits, things like that. Lots of antioxidants in that sort of diet. They did study it there was one study that actually looked at it. It's really hard to study diets because you can imagine it's hard to monitor everything people eat and to control how one person's diet compared to another. But in this one study of the Mediterranean diet, they did not find that it slowed progression of the disease. That doesn't mean that you shouldn't have a healthy diet, though. I still think it is important for your overall health to be maintained. And a healthy diet that's high in antioxidants, why not? There's certainly no harm to it. I often recommend that to people. But I think it's also important to pay attention to the calorie content. And we know that people with Huntington's often need a high calorie diet because metabolically in Huntington's, there's just a faster metabolism, and there's also all the movements, which are constantly burning calories. And so we need to often work with a dietitian or a nutritionist who can guide you on healthy ways to increase calories, and that also provides good nutrition. So sleep, just some of this is common sense, but oftentimes it has to be said. I mean, insomnia itself can be a common problem in Huntington's. The chorea can keep people from being able to sleep. Lack of daytime stimulation is a common problem that leads to trouble sleeping. So if someone's not active all day, you're just sitting on the couch or lying in a bed all day long, it's impossible to fall asleep then at night. You got to be active during the day. We see this in the hospital all the time. Often when someone's admitted to a hospital, they're in a hospital bed all day long, and then they just can't sleep at night. So you got to get out of that hospital bed, get into the chair, sit in the chair during the day, get up and move around, and then get into the bed. It just makes it easier to sleep. So the more active you are, the better. Depression can lead to trouble sleeping. And then just the sleep-wake cycle, the program itself in the brain can be wacky in people with neurological diseases. So the way we deal with this, well, we try and treat the chorea with medications to suppress the chorea. We try and, again, maintain that wakefulness during the day as much as possible so that at night you're sleepy. Getting regular exercise. Sometimes a warm drink at night can actually help relax the body and the nervous system. And then keeping a set schedule is important. So not having random times where you're sleeping at night, but having a set schedule makes it more likely that your brain will know it's bedtime and feel sleepy. Trying not to eat heavily right before bed, and certainly avoiding spicy foods right before bed. And then just keeping the atmosphere comfortable for sleep. So keeping it well ventilated and dark and quiet at night. And then sometimes bedtime rituals help. If you're in bed and you just can't sleep, you need to get out of bed and do something boring, like read a boring book. Read a book about neurology, and just sit there and in a chair out of the bed and read until you're sleepy and then get back into bed. When you do things that are stimulating in bed, like watching TV, the bed starts to become associated with more stimulating activities, and it's hard to fall asleep. And lastly, I want to talk a little bit about stress and about how family members or caregivers interact with people with Huntington's. And so the first is the issue of kind of patience and understanding. So one thing that can really help someone with Huntington's have a better quality of life is just allowing them extra time for tasks, avoiding that pressure. When there's a pressure to do something is when it does become harder. Allowing extra time for response to questions. If you're in a doctor's office and the doctor asks the person with Huntington's a question, give them a little bit of time to answer that question. Don't rush them. Don't try and answer for them necessarily. Let them communicate. And that's true in their social settings too. They know what they want to say often, and it just is a little harder to get it out or slower to get it out. And so they just need a little bit of extra time. Try and reduce distractions. Avoid the multitasking. That can also make a difference. When you're conveying information, I think it's useful to convey small pieces of information in short sentences that have 1 to 2 pieces of information in them, rather than, like I'm doing right now, being very lengthy and talking with too many words and too many points. So just kind of be more brief. And then frustration often results from lack of insight. I see this a lot, is that patients with Huntington's often have trouble being aware of some of their symptoms, and this can lead to frustration from caregivers who are seeing symptoms that the person with Huntington's may not be aware of. And you just have to recognize that sometimes full insight is not going to be achievable, and I see a lot of fighting happening between people trying to get the person with Huntington's to realize certain deficits that they're having, and it's probably not worth having those fights. Don't demand the insight, just focus on the achievable goals. If driving is an issue, and I know that's going on in one of the other lectures right now, don't try and force the person to realize their driving problems. Try and come up with goals for how you can prevent them from having to drive. That might be a better way to address it. Schedules and routines are really useful. I mentioned this with sleep, but having a predictable daily schedule can also reduce confusion, and it can reduce the outbursts or the irritability that we sometimes see with people with Huntington's, who can have kind of a short fuse sometimes. So having predictability is useful. And then offering choices. You don't want to be always telling someone with Huntington's what they need to do, but also they need some limitation in the choices about what to do. We're talking about things like bathing. You may want to give some options. Do you want to do that in the morning or in the afternoon, rather than being rigid about it, which can lead to more frustration. And then just outbursts in general can be a problem, and how to improve quality of life from that standpoint. So when someone with Huntington's, if they do have an outburst or become irritable very quickly, try not to react emotionally to that outburst. It's often a very quick change in mood that then kind of goes right back to normal after often a few seconds or minutes. But try and anticipate what the triggers are. Sometimes they're fairly mild triggers, but if you can prevent the outburst by identifying what tends to trigger the outburst, that can be useful. And then avoiding confrontation, just acknowledging that you understand that the person is irritable, that it's part of their frustration with either their symptoms or how to deal with their symptoms, and making sure that you yourself are safe in an event where someone does have an outburst. So just to summarize what I talked about. So the goal of HD treatment right now is to optimize quality of life and to maximize function. I hope that when I'm back here in the next 5 years that I say that the goal is to slow down the disease with this great new medication that we have. And I am very optimistic about that. Exercise is important at all stages of the disease and needs to be tailored to ability. And ideally it incorporates balance, strength, and aerobic activity. Consider multidisciplinary rehab programs that include physical therapy, occupational therapy, speech therapy, and so on for Huntington's. And also think about alternative forms of activity that are sometimes more exciting for some people. And then remember that healthy lifestyle goes beyond that and also includes paying attention to nutrition, sleep habits, stress management. Thank you. If there are questions, I can take some. Okay. Yes.
We got to retrain ourselves, and when we're hurt, we have to stretch. When we feel pain, we have to stop the exercise and stretch.
So the point that was made, just so everyone can hear, was that it's important to stretch, and that you really want to pay attention to, when you're exercising. Certainly if something hurts when you're exercising, you don't want to push it. You want to stop. You don't want to force something that's hurting. So if you want to stop and you want to stretch, I definitely agree with that. And you don't want to be exercising to the point where something hurts. You're right. Yeah. Okay. Oh, yes.
One thing over the years that helped me with my mom when she had HD was reminding her that she had a disease and she had limitations. So we have to talk about that so we can move in a different direction. And the more I talked about that, it was easier as the years went on to help her.
So the point that was made, so everyone can hear again, was that in this lady's experience with her mother, talking to her about her disease and kind of helping her recognize her limitations was useful in kind of having her see the symptoms of the disease. And that's, I do think it's important to have those discussions and to educate someone with Huntington's about their limitations and about their symptoms. Where it's not productive is where it gets to be a fight. And that's where I sometimes see that happening. That's where you want to kind of hold back for a second. And it's not worth having a fight over forcing someone to realize a symptom that they're completely not willing to acknowledge. And there it's more important to just kind of have goals for that person that they can manage. Yes.
Rob has been doing PT for 4 months. It was dormant for probably 3 years, and now he can get on a
That's great. So I'm going to repeat that because I know also there's online people watching, they may not have heard you. So with physical therapy and exercise, this gentleman is now using a standing paddleboard and able to, yeah.
No planks, no sit-ups, no crunches, everything was laying down or sitting up or that with a volleyball. I'm able to do 800 reps, and I break the 800 reps down because I do 15 minutes out, 15 minutes back. Every time, that's how good for it. And that's what I did. I do 100 bars, and then I do 2 minutes rest. 100 bars, 2 minutes rest. Now I have like 30 minutes. One day they come in, so give me 50 minutes more.
That's great. I think what I hear from that is I'm not hearing anything about degeneration or decline, right? And so I think that's such a great example. I mean, look at what he's saying. He's learned to do something that he couldn't do before he had Huntington's, and he's improving on that, and that just shows you that there is the ability to not only maintain function but to gain some function with a disease that we typically consider a degenerative disease. And so thank you for that point. That's a great point. Yeah.
Any suggestions to help motivation getting started, or is
Yeah.
it like
Right. So apathy is probably one of the biggest barriers to exercise in people with Huntington's. Apathy and also the lack of awareness of the need to do things, right? And so it's challenging. I think sometimes, not always, but sometimes treating depression, like antidepressant medications, can sometimes improve apathy, but not always. There are no good medication treatments for apathy. And so beyond that, it needs to be something that probably is not conventional exercise in those situations. I think the best chance is to do something to find something that person used to enjoy or that they still enjoy and make that an activity that they can do. And that's why I tried to bring in some examples of alternative activities. I mentioned things like gardening and other things because sometimes people will find some connection to something that they will enjoy doing. But yeah, I don't have a magic cure for apathy. It is a difficult symptom to deal with. Social things also, I would say, sometimes having an interaction with certain people will bring someone into a group class of some sort. For some people, will make them more likely to do an activity. But yeah.
My question is, I just was diagnosed with this, and I started off by going to physical therapy, and the doctor wrote it for 10 weeks. And I'm saying 10 weeks, this is my whole life. So what do you do when you get a 10-week
Yeah.
prescription?
So the issue is the issue that she's bringing up is that physical therapy is finite and it's limited and it's usually only several weeks. And so it's not. So first of all, as a physician, I would if I have my choice, I would have every one of my patients with Huntington's getting endless physical therapy every day for the rest of their life. It's not how it works because number one, we have insurance limitations, and insurance will only allow typically a certain amount of physical therapy. And so that's why I say it's really important to, once you've gone to those therapies, is to get a written plan that you can do at home. Because it's not realistic that you'll be able to get it all the time. And if you do get your 10 weeks and you feel good, you're going to lose that benefit if you don't get to practice it. And I often see people leave that therapy without a specific plan. I don't know if most therapists give a specific home plan or not, but I don't see people often doing it. So I tell my patients when they go to physical therapy, that's the first thing that they ask for, is by the end of my 10 weeks, I want a specific written plan of what exercises I need to do, and they should be teaching you how to do it. So by the time you're done with therapy, you should at least know how.
But I do it incorrectly.
You do it incorrectly even after they show you to do it? Yeah.
Because my foot doesn't go the way they want it to go. If they're standing there and
Hmm.
then they force me to do it correctly.
Right. So it might mean that you need to do a different kind of therapy. I mean, I understand what you're saying. If you can only do certain therapies or exercises with the therapist there, those aren't things that you can do on your own. There might need to be different exercises that you can do on your own. It has to be tailored to you. And so that's something where I would probably have a communication with the therapist and say, I can't do this on my own. Is there something different I can do on my own? But you probably wouldn't know that until you tried it on your own and saw that it was hard to do. But it is probably something that you have to go back and say, is there something different? But you will. But it's not. I wish the answer was just get more physical therapy. It just doesn't. That's not how it works in this country. We can't just. We can. I'll usually re-refer every time if someone has a decline or something new is going on. Then I can usually re-refer. Or maybe if it's a new year, I can usually re-refer. But nobody can get it all year long. Yeah. Yes.
So I think really what I got out of listening to you today was you're all about multidisciplinary rehab. And you've got a place you can send people, your other lab, and you work that way. And that's a really cool idea. I don't think I've ever really heard of that. And I think it's something I'm going to take back to where I'm from, talk to other local support people about maybe finding or seeing how we can do something.
Yeah, for people who are interested in multidisciplinary rehab programs, and if there maybe isn't one that you know of that's near you, one thing is, I'm assuming you have a neurologist near you, though. We didn't have a Huntington's multidisciplinary clinic until a couple of years ago. When we started the Huntington's program is when we said, well, we have a great rehab facility and we have therapists who do all these special things. They don't know anything about Huntington's necessarily, so let's train them. And so we got them trained specifically in Huntington's, and HDSA has resources to help people do that. And then we educated them also about the disease. So I go there and I talk to the therapists about Huntington so they know what to expect. And that's how we formed a multidisciplinary program. So you find a place that has these therapists, and then they can be grouped together into a Huntington's program and be trained. And so usually the neurologist or someone who would be the one to initiate that, but it's definitely something that's doable.
And we have a good group, and
Yeah.
they already do a lot of that stuff. I think I like a little bit more exercise.
Yeah. Great. I saw a question in the way back. Yeah.
Yeah, I think because I have cognitive issues, I have cognitive procedural issues. So sometimes doing certain types of exercise, I don't remember how to do it, like when you're lifting weights or something. So I do simpler exercises like biking or running, and then I do group exercises like dancing or yoga or meditation in groups, and it helps me because then I'm doing it with other people, and I might be like 10 seconds behind. I don't do the kind of yoga that you have to move quickly. Like flow is not good for me. I do Kundalini yoga or Bikram yoga where you hold positions for a long time, and that works. I can always cheat and see people next to me doing it correctly. But I think that really helps. Like when you work with other people in community, it makes you happy while you're exercising, and it gives you encouragement. So that's my insight into what you're talking about.
Thank you. So there's just she was advocating for group classes, which especially if there is trouble kind of figuring out what to do on your own or remembering what to do, these group classes can be useful, but tailoring it to your own needs, not going into the local gym and going to the yoga class that the 20-year-old girls are doing and going into all these different positions, but finding one that is appropriate for you and doing it at your own speed. I think that's great, and I think some of those ideas like yoga can be really useful. Yeah.
How do you know you're getting aerobic benefit?
So the way you know that you're getting an aerobic workout is what we would call moderate intensity aerobic workout, which is pretty much the goal that I like to see most mild or moderate, early or middle stage people at, is if you get your heart rate up, you'll know it because it should get to the point where you can't easily have a conversation. If you're just taking a light walk. You can usually have a conversation with someone, and that aerobic workout is a little, it's better. It's certainly better than being sedentary, but it's certainly not getting your heart rate working too much. But if you can't have an easy conversation, if you're a little short of breath, if you can't sing a song while you're exercising, then that's a pretty good aerobic workout. And so that's usually the song test is the best way to know you're getting kind of moderate intensity exercise. But I think what we know from just general heart guidelines is that 30 minutes 3 times a week of moderate intensity aerobic exercise is what everybody should be doing, regardless of any disease. And certainly with later stage Huntington's, that's not possible to necessarily get your heart rate up that high. You can try stationary equipment, and like a stationary bike if you're probably in the middle stage, and that can get your heart rate up. But you do what you can, and certainly any activity is better than nothing. But that's kind of a test for how the level that you're doing is. Yeah. Yes.
There are other walking, there are other, like cat-cow and other kinds of exercises. Are those aerobic or not? How do you tell?
Which ones? I don't know that one that you said. I'm not familiar with that one.
Cat-cow, ball lift, things like that.
Yeah.
Balls between your legs.
So a lot of different things can be aerobic. Certainly, it's not limited to walking, running. Really, anything that gets your heart rate up is an aerobic workout. And so sometimes just strength building exercise can also be aerobic if you're getting a workout. And if you're doing some of those things that I mentioned, like even working with a ball and going side to side like that, that can be an aerobic workout if you're, as you kind of do that more and more, and you're doing more reps and doing it faster, that can be an aerobic workout too. So there's not a specific recipe for the right workout. It's what's right for you. Yes.
We also did the 12-week of physical therapy, and then it was recommended we just go to a gym, and we go to a gym. We were lucky to find a personal trainer who is certified in geriatrics. That's not always possible to find a physical therapist like that. It would be
Yeah.
great to have resources where we could find, someone that we could just ask when we're at the gym, and are we doing this right, or what should we be doing?
Yeah, unfortunately, the local gyms are usually not very effective for people with neurological diseases to find the right kind of classes or specialists who can help you. Personal trainers are, if you can afford them, because insurance doesn't cover them, personal trainers are great as a way of, after you've gotten your physical therapy, often the personal trainer can go with you to the therapy classes, see what you're learning, and then kind of keep practicing that with you. But that's a best case scenario if you can actually have a personal therapist, personal trainer. So usually you need to find, in my experience, usually you have to find group classes or exercise specialists who are affiliated at least with an academic center where there will be classes specifically for people with neurological diseases. We often have we have classes for Huntington's, we have classes for Parkinson's, we have classes for Alzheimer's. It doesn't really have to be disease specific, but there's classes for people who are elderly, which also can be a sign that the therapist knows how to work with people with physical limitations. And so these sorts of things can be useful, but you're not going to find that at a local gym. So that's challenging. Yeah. They're not available everywhere. That's right. Yeah. I think this is an opportunity for us to work on better like DVDs and things like that maybe through HDSA to work on exercise programs that we can bring to people's homes too. So if you don't live close to one of these places, it'd be nice to have something you could look at and practice. I think that's an opportunity that we probably needs to be worked on more. Yes. Yes. Oh. Oh, that's important. So I want to repeat that. I didn't know about that. So the speaker we had today, Shayna Verstegen, apparently has exercise DVDs for people with Huntington's on the HDSA website. So something to look at. Sorry. Okay. Thank you. Good timing.